I'm Kara Murray, I'm 31 years old, and I was diagnosed with leiomyosarcoma. I was scratching my back one day and noticed a small lump on my back between my left shoulder blade and spine. I didn't really think anything much of it at first and kind of pointed it out to my husband, who was my boyfriend at the time, and he said, maybe you should get that looked at. So I made a doctor's appointment, and when my doctor looked at it, she said it looks like a sebaceous cyst to her. A little while later, it started to grow. I went back to my doctor's for a routine physical and showed her again. And she said that it looked just like a sebaceous cyst. It was nothing to worry about. I asked about getting it removed, and she said it would actually be cosmetic to have it removed, so it would cost me money. So my doctor took another look at it and said that she could set me up with a surgeon to have it drained. I was told it'd be about 2 months wait roughly to get in to see a general surgeon. I went home, and not too long after, it started growing faster. I ended up in tears doing tasks such as dishes or waking up in the morning as my spine was hurting me so bad. I called my mom one day, crying to her about the pain I was dealing with, and she ended up calling my doctor's office and telling them that they needed to get me in much quicker, as she was very concerned. So they ended up getting me in the next day to see a general surgeon. He cut the tumor open, and he tried to drain it, thinking it was sebaceous cyst as well. And when he did, he realized that it wasn't a sebaceous cyst, and he told me he wasn't sure what it was. So he said he'd send a biopsy away and get the results to me right away. And when we went in there, we knew things weren't good, as there was nobody else in the doctor's office but us. And when we looked at the nurse, she couldn't even speak to us. We went into my doctor's office, and my doctor then told me that I had cancer. My mom and doctor and I all sat there crying. She wasn't sure what type of cancer exactly I had at that point. She said it was most likely a type of sarcoma, which I had never heard of before. So she told me they would get the final results in a week or two, and she would get a hold of me as soon as possible. I remember waking up the first few nights and thinking it was all just a bad dream. I even woke up the first night and called my mom in the middle of the night and asked her if it was all really true. For a long time I had a hard time saying the words, "I have cancer." I had lost my dad to cancer the year before, and I knew from personal experience how scary cancer could be. It was so difficult to tell my family and friends, as anyone that I told, of course, their first reaction was to cry and be very upset and scared for me. It made it a lot more difficult for me in the sense that it hurt me to see them hurting, and also it made me worry more and be more scared. So it was always nice to have some positive outlook. It just helps so much to have positivity in my life and have people trying to kind of keep me positive and thinking happy thoughts, and when I got thinking negative, to say, you know what, don't think that way, it's gonna get better. It just helps so much. I had to initially see a gynecologist-oncologist, as typically leiomyosarcoma starts in the uterus in women. That was an extremely difficult time period in my diagnosis, as my first thoughts were, am I not going to be able to have children someday? And it was not just a concern of mine, it was a concern for my boyfriend at the time, who we had been together for a very long time already, about 4 years. We had just bought our first house together, and things were going great in our relationship. And to find out that I could potentially have to have a full hysterectomy at 24 years old was very scary for both of us. I ended up finding out that the cancer had not spread at all. It was just localized to the tumor on my back. I ended up having 25 radiation treatments, so I would go to Kingston 5 days a week for 5 weeks and have my treatments. I found I felt like a human guinea pig my first treatments, because I had doctors and nurses and radiation technicians standing around me, trying to figure out the best way to do my radiation, as it was kind of in a weird spot for them. It was kind of a new thing for them, so it was just very awkward for me laying there on this bed waiting for my radiation while they decided how to go about it. I was so scared after my surgery. I remember waking up and feeling the tightness in my back and just not knowing what they had done, and I knew it didn't feel normal. I remember when the nurses were bringing me up to my bed, I broke down and cried and cried and cried. It was so nice to see my family once they arrived at the hospital. They had been waiting for me to come into my room. I went home after a day. I begged to go home from the hospital as I just wanted to be back home again. I ended up having nurses come in, VON nurses, to change my dressings and to take care of my drainage tube. It was a really low point for me after my surgery, as I was really starting to feel the pain and know that my back was never going to be the same again. I ended up having a second surgery unexpectedly in February that next year, so in 2007. They removed some more tissue and some more muscle, because the first surgery they didn't get all clear enough margins. Because of my age and because I'm so young, the doctors don't really want to do scans very often on me, as the amount of radiation I'm receiving every time is greatly increasing my risk of developing a secondary cancer down the road. So they have limited my number of scans that I receive, which kind of scares me. I don't know, I'm one of those people, I'd rather have a scan and have that reassurance, but they don't like to do them as much. But the last scan I had was in 2010, the summer before my husband and I got married, and there was no signs of disease then. In January 2012, my husband and I welcomed our baby girl into the world, Evelyn Louise Murray. I was approved by my doctors that they gave me the go-ahead to have children, and they gave me their blessings. She is a constant reminder to me of how lucky I am, and we are now expecting our second child in March. Okay. I feel so lucky and blessed to be one of the lucky ones that has done so well and beat cancer and made it this far. I'm thankful for every day I have, and I appreciate everything in my life, even the bad, the good and the bad.